This presentation for Module 5 for Nursing 150 will discuss care of the patient with colorectal cancer. Colorectal cancer, or cancer of the colon or rectum, is a common malignancy, unfortunately. Most colorectal cancers are adenocarcinomas, and typically they arise from the glandular epithelial tissue of the colon and develop as a multi-step process. Typically, abnormal proliferation of the colonic mucosa first forms polyps. These polyps can transform into a malignant tumor. Tumors can spread by direct invasion or through the lymphatic and circulatory system. The most common sites of metastasis are the liver, lungs, brain, bones, and adrenal glands. Complications of colorectal cancer include bowel perforation with peritonitis, abscess or fistula formation, hemorrhage, or complete intestinal obstruction. Risk factors are patients older than 50 years old, genetic predisposition, personal or family history of cancer, or diseases that predispose to cancer. Crohn's disease and ulcerative colitis are also risk factors for colorectal cancer. In the United States, colorectal cancer is one of the most common malignancies. Patients often consider this to be a poor prognosis, but truly, in reality, colon cancer has a highly curable rate. This picture just kind of shows you the incidence of where colorectal cancer occurs most. If you notice, I don't know if you find this surprising at all, 30% is mostly around the sigmoid colon or rectal cancer. Is the highest incidence at 30%. The second most highest incidence is the sigmoid colon. So it's typically more in the lower large intestine. This is just a list of some of the risk factors for colorectal cancer. It is thought to be a very genetically connected cancer. In fact, people with a first-degree relative, which means when we talk about first-degree relative, we're talking mom, dad, sister, brother. If they have a first-degree relative diagnosed with colorectal cancer, they have a 3 to 4 times the risk for developing disease. What does this mean? This means that patient is going to be identified as somebody with high risk factors, and definitely at age 50, they will need to get that colonoscopy as a screening, if not sooner. If they have any signs and symptoms sooner, they're going to get a colonoscopy sooner. And they need to get one more frequently than the average person, just because it's found that people with colorectal cancer, it tends to run in families very specifically, and so we need to be very diligent in getting them screened for this type of cancer. Again, it's a treatable cancer, but we need to find it early. We need to treat it early. Other risk factors possibly associated with colon cancer. Again, H. pylori pops up. They think there is some connection. Also, there's a strong evidence that long-term smoking, obesity, physical inactivity, and heavy alcohol consumption can also be a risk factor for colorectal cancer. Diet can play a part. High-fat diet, particularly animal fat from red meats, is thought to be associated with colorectal cancer. Diets with large amounts of refined carbohydrates that lack fiber are also tend to be associated with colorectal cancer. So think about what all this information means to you as a nurse, as far as assessing a patient, asking them questions whether they're having any signs and symptoms of colorectal cancer. These typically are talking about noticing any bleeding, rectal bleeding, notice any irregular bowel movements, change in bowel movements, sudden change in bowel movements, weight changes. And then you begin to ask them questions about their diet. Are they having a high intake of fatty meats, low fiber? What kind of foods? Excessive alcohol, excessive smoking. Is this the kind of lifestyle they have? Well, maybe they are at higher risk, especially if they have a family history. So start thinking about what that means to you as a nurse and how we can kind of identify those patients at high risk for colorectal cancer and how we can begin to screen them. That would be an occult blood test, see if they do indeed have blood in their stool. If they do, we need to get them in probably for a colonoscopy in order to determine if there's polyps present, which we know that polyps are precursors for cancer, so we need to determine if that's there. People who have ulcerative colitis or Crohn's disease tend to be at high risk for developing colorectal cancer. Is that in their history? If it is, we need to do some screening. We need to do some assessment to determine whether they're showing any signs and symptoms of colorectal cancer. If they are, we need to check them because we know that any kind of cancer, you need to find it early, treat it early. Okay, this slide just provides information regarding the staging of colorectal cancer. We've talked about this in the past. Stage 1 means that it's typically contained within the organ itself. Moving on to stage 4 means that the tumor has invaded other parts of the body and that there is some metastasis going on. Just want to talk about briefly the clinical manifestations of colorectal cancer. They can be kind of vague, and so it's important to educate our patients. Typically, the most common signs and symptoms are rectal bleeding, anemia. So think about what anemia means to your patient. Are they tired a lot? Are they coming in complaining of being tired, a weird fatigue that they haven't had before? Maybe we need to work them up, okay? Have you had weight loss as well? Do you have a history of colon cancer, family history, things like that? Also, a change in their stool consistency or shape. So maybe now they've had a lot of loose stools in the past couple months. So we need to ask them questions about that. The other thing to consider is the site of where the colorectal cancer might be. If somebody has some bleeding that might be occurring over in the ascending part of their colon, they might not have obvious signs of bleeding. Someone who has maybe some cancer occurring over in the descending or the sigmoid colon, the blood might be a little bit more obvious. So just think about that. And we'll talk about that a little bit more in the next slide. We have some pictures of kind of where the cancers occur in the large intestine. Okay, this is a good slide that tells you about colostomies, about where we might put an ostomy in the event that someone needs pieces of their colon removed. I want to use it also to kind of think about the signs and symptoms that a patient might have if they have a tumor in a certain part of their colon. It's interesting, the transverse colon is this part right here. So if somebody has a tumor in the transverse colon, they will typically show signs more of an obstruction, which basically means the tumor is kind of obstructing the flow, the peristalsis, if you will, of stool through the large colon. As opposed to someone who maybe has a tumor down here in the sigmoid area, these patients will typically have more of the signs and symptoms of the bleeding, the more obvious signs and symptoms of blood in the stool. Patients, and we'll talk about this in another presentation about obstruction, but if somebody is having an obstructed bowel, they'll start showing signs of distension of their abdomen. They will have decreased bowel sounds, things like that. So we need to be very diligent in our assessment of a patient who is at risk for having a colon cancer to try to kind of do a very good GI assessment. This slide is also a good visual for you to understand. If we do an ostomy means that we create a stoma on the outside of the body for the body to rid itself of the stool, which the stool is how we rid our body of things that we do not need. If there is some kind of a tumor and the ascending issue here, we're going to have a stoma here. So we might have to take out part of the colon that is cancerous, create a stoma, and let this area heal. And basically what we need to understand, if there is a stoma in the ascending colon, The stool is going to be a little bit more watery than if we create a stoma here towards the end. And and basically what this slide helps you understand is the fact that the stomas and the ostomies can appear in different parts of the patient's abdomen. It's important for you to note where it is in order to determine whether the stool should be a little bit more formed as opposed to a little bit more watery. So over here it's going to be more watery. Over in this area it's going to be more naturally looking formed stool. That's the important piece of this slide here for you to understand that the stomas may appear in different parts of the colon. You need to note where it is and to note what you expect comes out of that stoma. You have a presentation from the wound ostomy nurse at the Christ Hospital. She does a really good job of talking about colostomy care. I'll just kind of speak about it for a few minutes. Basically, a new ostomy, a new stoma, means it needs to have a good blood flow to it. We need to look at it and make sure it's kind of a beefy red color. If it becomes necrotic looking, cyanotic looking, which means it becomes pale blue, that means it's lost blood flow, and that's something to be concerned about. That would be a sign and symptom of complication. Basically, looking at it to make sure that it's protruding out of the skin, that the skin around it is healthy. Priority nursing care of a patient who's undergone an ostomy consists of assessing the color and integrity of the stoma frequently. The healthy stoma should appear reddish pink and moist and protrude about 3/4 of an inch from the abdominal wall. During the initial postoperative period, this stoma may be slightly swollen or edematous. There might be a little bit of edema and bleeding initially. A large amount of bleeding would be concerning. A large amount of edema would be concerning. So it's important to look at it, monitor it frequently. Again, I highly recommend that you review the presentation by the wound ostomy nurse. She does a great job of presenting stoma care. This is a case study that helps you review and assess your learning regarding colorectal cancer. I encourage you to look at the questions. The answers are in the comment section of the PowerPoint that is posted. This concludes the Module 5 presentation regarding colorectal cancer.